Welcome to the Medical Maverick Show, where we search out the best of the best doctors and dentists in their chosen profession. Every week, we turn our spotlight on breakthrough medical and dental treatments that can provide you with the best possible care you can get. Thanks for stopping by, and enjoy the show.
Hello, everybody. This is Eric Batty, and I'm your host today on the Medical Maverick Show. And on today's program, we have a very special guest who's going to speak with us about short-term adult orthodontics, and she has a unique and natural way of getting your teeth straight in as little as 6 months. I have with me Dr. Munira Lokhandwala with Starbrite Dental in Fremont, California. Doctor, thanks for taking the time and being on the show today.
Hi, Eric. Thank you. It's my pleasure.
Great. It's ours, too. Well, let's just start off just by telling us a little bit about yourself and what got you basically in the field of dentistry.
So I come from India, and I went to dental school in India. I graduated in 1991. I moved to the U.S., and I got my license in California, and I've been practicing here since about 96. I have a beautiful office in Fremont, and we have, the latest technology, and we actually provide dental services for the whole family. We see little kids, we see grandma and grandpa. So the treatment that we offer ranges from the traditional simple cleanings to laser gum treatment. We do implants. We do sedation dentistry for children. We do IV sedation for adult phobic patients. We also offer cosmetic veneers. We do Botox for TMJ patients who have migraines. We also do CEREC crowns, which are the CAD-CAM crowns. It's a really exciting option in dentistry. Patients just get the crowns done in one visit. They don't have to return back for the cementation appointment. They fit beautifully because it's a very accurate fit. We love them. Patients just love this technology. And then, of course, like everyone, we've been offering Invisalign for a very long time. Invisalign is a straight way to straighten your teeth, a clear way to straighten your teeth with aligners. And then for about the last 5 years, we have introduced what we call, or the dental industry is calling, short-term orthodontics. This is basically for our adult patients who have missed the boat when they were younger or who want to touch up on a previous orthodontic treatment.
Yeah, and that's a good point. I myself hadn't, did not have the opportunity as I was younger, and took it and done it later on. But you also are noticing a lot of people that haven't maybe kept the retainers in check, that are seeing the benefits of this. Am I right?
That's perfect. That's the perfect candidate for short-term orthodontics. These are kids who didn't wear the retainers. Now they are in college or they're looking for a job. Their teeth have shifted and they no longer want to wear long-term orthodontics. So this fits perfectly with that lifestyle. And also for adult patients who have busy careers and who have kids who themselves are going through orthodontics and they do not want to go through comprehensive 2-year programs. This works really great for them too.
Wow, that's great. So what is the difference then between, say, a youth in braces versus the adult then?
There isn't. The equipment or the technique is almost the same. The focus for short-term orthodontics is actually on front teeth. Adults have this bite which has already been set. By the time they finish growing, their bite in the back teeth is pretty good. They don't have any complaints. What they want to do is straighten the front teeth. When they traditionally have gone to an orthodontist, it's usually a comprehensive approach. Sometimes it takes 12 months, 18 months, 24 months, because the orthodontist wants to correct everything. We generally only want to focus on front teeth, and sometimes we do focus on back teeth, but our main goal is to correct any kind of crowding or overlapping which might be present in the front teeth. So we use special wires which are called shape memory wires. These are nickel titanium wires, very low force, very comfortable, and sometimes to speed things up, we do something that we call enamel reproximation, or terms like interproximal disking or enamel stripping. What this does is we use a very fine diamond strip which we put between the teeth, and we just lightly, slenderize the teeth a little bit, just tiny bit, 0.1 millimeter. We spread it out. This allows us the room to move the teeth in the desired position. So that would be one major difference. We do what we call enamel reproximation or IPR. Some of the terms the patients might have been hearing online. This helps us to move teeth quickly, predictably, and safely, and improve the appearance.
Well, that is fascinating. I had not heard about that. We talked about different options in the adult area, power procs, fast braces, and 6-month smiles. You do all three, correct?
That is correct. I started off with power procs in about 2008. It's a great system. I still use it. There are newer techniques out there. I also use fast braces. Fast braces is one wire, which is used throughout the treatment. It has changed where it's just one wire. We also offer 6-month smiles, which is also very popular with patients these days. Basically, these are all cosmetic teeth-colored or ceramic brackets, and they get bonded to the teeth. And the wires are actually also white in color. They have a titanium dioxide coating. So it enhances the appearance. You don't see the metal flash in the pictures or when you're talking to somebody. So I offer all three at my practice.
That is just awesome. So the benefits, what are your patients seeing? What type of reactions are you getting after patients have gone through the treatment?
One of the reasons we want patients to have straight teeth is it improves the overall hygiene. Crooked teeth or crowded teeth leads to food lodgement, and these are the patients who always have tartar accumulating between the teeth, or they have stains, and tartar leads to gum disease, which leads to bone loss, which leads to tooth loss. So one of the biggest advantages is improving the overall health of the teeth by straightening them. When you have straight teeth, it's much easier to brush at home and floss. Straight teeth also has, leads to better self-confidence, I believe, in some patients, especially patients who are working in the hospitality industry. They have sales jobs. They want a perfect smile. So I've seen some of my adult patients are very motivated from that aspect too. They take better photographs. It leads to better facial profile. They like to smile more. I've had ladies who tell me that they don't get any more lipstick on the teeth. So this is really working out really great for our adult patients, and the response is amazing. They cannot believe, how wonderful the treatment has gone. 6 months have gone by. Many of them tell me, I wish I had done it sooner. And it's just, it's so rewarding, when you give them the mirror and they look at the teeth and they're just like, wow, I should have done it before. It's really great. We love doing this in our practice.
Wow, I bet you get some satisfaction and seeing your patients get that benefit too. So what kind of factors, as far as length and time, because I've noticed, the 6 months is kind of a staple. Is there sooner? Is there some later? What causes difference in variation in time?
So 6 months is kind of a range. Some patients, as you mentioned, somebody who had an orthodontic treatment as a child might just have lower teeth which have shifted, or one tooth is out of alignment. It's pretty quick. We could be done within 3 to 4 months. Whereas some other patients who have more crowded teeth, or who have teeth which are in a deep bite or a cross bite, they would need a little bit more than 6 months. Our goal is to keep cases within the 8-9 month range in our practice. If it's going to be anything beyond the 6 month scope, we do want them to see an orthodontist, because that is not the kind of cases that we would want to treat with short-term orthodontics. So the case selection is important, but most adult patients who have front teeth which are crowded and good, stable back teeth are perfect candidates. And 6 months is a pretty good range for most cases, maybe a month or two beyond for, some complicated teeth movement.
Okay. So what type of schedule, how often are the patients coming in? Is that differ from, if it's a spacing case or if it's a crowding case?
So technically, we're supposed to see them once every month, and that's what we generally aspire to, and that does happen. When do we see them more often? If a patient has a spacing, sometimes it helps to see them every couple of weeks because we change the elastics out so things progress faster. Also depends on the patient's schedule. So generally, I would say once a month is a pretty good, time frame for most adults to, work with. And towards the end, maybe when the braces come off, they have 2 quick appointments for the retainer impressions and a retainer delivery. But otherwise, once a month is the schedule.
Is the schedule. Interesting. What can you tell us a little history, on this type of treatment? How long has it really been around? You said it was about 5 years ago when you first had brought it into your practice.
Right.
How long has this technique been around?
This technique has been around for a long time. Basically, general dentists like me who had patients in the practice who needed to straighten the teeth to improve oral hygiene were very reluctant to go ahead and commit to anything which was 18 to 24 months. We kept seeing them in our practice every 6 months, and we would urge them to go, but they never took the next step. So general dentists in the U.S., Power Procs and the short-term orthodontic 6-month smiles, also short-term 6-month smiles and Power Procs was, I wouldn't say invented, but they were started by general dentists wanting to offer this treatment to their patients. Fastbraces was offered by an orthodontist. So in my practice, I had a similar situation where adult patients were reluctant to go and seek treatment. What happened in our practice was we had a young lady who came to us, and she was going to get married in about 6 months, and she had one upper tooth which was sticking out, and she just wanted to straighten that. I referred her to my local orthodontist, and he said there are some other things with her teeth in the back which I need to fix, so I really cannot commit 6 months. And she said she's getting married. He said, okay, let's do this. I will start the treatment. We'll take the braces off for your wedding, and then we'll finish off with Invisalign, or, we can put the same braces back on. She was not really happy with that outcome. It would cost her more. And I knew that there were general dentists doing this. So that was one of my main motivating factors, helping some patients who need special or custom-made treatment plans. And I think it was demand in my practice that I finally thought we should meet, and that's how I got into short-term orthodontics.
Wow, that is fascinating. What can a patient generally expect as far as pain or any discomfort while they're in treatment? This
orthodontic treatment is actually pretty easy to get used to. But like with anything, I think the first week is what you can expect to have the most discomfort. Teeth are sore. We do ask you to eat soft foods. The inside of the lips and the cheeks, they get sore from the brackets because they are getting used to it. We ask you to apply wax, and it works most of the time. Within a week, the lip mucosa is used to having the bracket on it. We ask you to take some ibuprofen. It helps to eat ice cream. Cold helps. Sometimes we also alternate it with warm salt water rinsing because it improves the blood circulation. And then as they come every month, we usually tell them to take an ibuprofen before the appointment. So that helps to make the appointment go more smoother. And most patients, I think, from our experience, only complain that the first week was the toughest, but everybody gets used to it, and there are no more complaints regarding pain after that.
Gotcha. Is there any other health issues that patients that may have allergies or anything that might affect or the impact of the treatment?
When we select the case, we make sure that the jaw joints are stable. There isn't anything which would flare up during treatment. We make sure they've had a complete dental checkup. The gums are healthy. And that's about it that we're looking for. There might be very, very rare instances where, somebody might have a nickel allergy. We use nickel titanium arch wires, but it's very rare. If somebody has a latex allergy, we use non-latex elastics. So not really. If we have selected the case well and done our background information, we look for everything. Most patients do very well with orthodontic treatment.
Interesting. Now, this is an interesting one. What about the eating and foods and foods that should be avoided? I'm sure that maybe hard candy probably wouldn't be advisable. Is that true?
That is correct. Most adults tell me, I don't need that anymore, so I have to believe them. But yeah, we do want them to avoid foods, that would pop a bracket off or break a wire. Hard candy is really tough on the brackets. Chewy candy as well. No caramel apples for them. Biting into an apple is tough. We ask them to cut it up. Biting, corn on the cob. Biting into hard, crusty French bread. Anything which would put pressure on the bracket, we ask them to avoid. Apart from that, if they're going to be eating a very high sugar snack, we ask them to make sure that they have brushed their teeth or there's nothing sticky, around the brackets which can cause dental decay. So most adults, I think, are responsible, and we've had pretty, good compliance in our practice.
Right. So any other special care, as far as you recommend a dental pick during this? What about flossing? What should they do during treatment as far as the care there?
Definitely, oral hygiene needs to be worked upon very thoroughly. We recommend most patients we recommend brush after breakfast, especially if they have brackets on the teeth. They will brush after breakfast. They will brush at night before going to bed, so that's brushing after dinner. And in the afternoon, we ask the patients to brush, if they don't want to use toothpaste, to dip their brush in mouthwash. If they've had a snack which is very high in sugar, very sticky, we want them to brush right away. At night, we ask them to use these special flosses, which are used to go underneath the arch wires and, clean the gum lines. Water flosser or water pick also works really well. It dislodges any food that you might have missed in brushing and leads to really good gum health, which is very important when you're undergoing, orthodontics. So not a lot of burden, but yes, we definitely want them to, stress more on the water pick or flossing underneath the brackets.
Yeah, so just basic good hygiene is the way to go there.
Correct.
Okay, so what can your patients expect post-treatment, and what further care is needed to maintain the straight teeth?
As I said, most patients just love what they have spent the time and money to get, so they're very excited and they're very motivated to keep their teeth straight. We basically recommend two kinds of retainers. One is a fixed wire bonded retainer, which goes on the inside of the lower teeth, lower teeth and the upper teeth. If the patients are not going to be complying with removable retainers, that's what we recommend. Patients who do not want anything fixed bonded, we recommend the retainers which are removable. We call them invisible type or Invisalign type retainers. They're very comfortable to wear, and retention is something that most adults need to keep in mind at this time. We say retention for life. Adult teeth are different than, when teeth are moved when they were younger. The bone in the front teeth is very thin. It takes a long time for the bone to stabilize. So we want them to wear the retainer every night. And sometimes, I've seen adults from other practices who have broken a wire, and even after some years, the teeth have shifted. So sometimes we give the bonded wire retainers, and as an insurance policy, we also give them a removable retainer. So in case something breaks, they have a removable retainer to keep their teeth in the same position till they can seek treatment to fix the bonded wire. So I think that's probably it, just retention and regular cleaning with the dentist.
Yeah, that's great. Now, what about cost and does insurance cover it? What kind of financing options are available to your patients?
The cost is generally lower than traditional orthodontics with an orthodontist because of the time frame. Most insurance will cover because it is considered orthodontic treatment. Insurance will pay their share, and the patients have their share according to the percentages. We, in our practice, offer patients care credit. We offer in-house financing. So it is very affordable, and most patients are finding it very easy to seek treatment for this and start orthodontic treatment.
Great. Well, that's awesome. We want to thank you again for being on our show. And if our listeners want to learn more about you and your practice or get in contact with you, what's the best way for them to do that?
So we are located in Fremont. They could reach us by calling our main office line, which is 510-795-7786. Our office is Starbrite Dental, which is BRITE. We have two websites. They could go visit us on www.eastbaydentist.com or our other website, which is www.starbrite, which is STARBRITE dental.com, starbritedental.com. We are actually open 6 days a week, Monday to Saturday. We do offer complimentary consultations, so we welcome any new patients to our practice.
Awesome. Well, thanks again, Doctor.
Thank you, Eric.
Yes. Okay. So if anybody's in the East Bay area, be sure to contact Dr. Lokhandwala and that's Starbrite Dental for all your dental needs. Okay. And that's about it for this show of the Medical Maverick Show. So we want to remind you to stay informed, feel better, and live healthy. Thanks, everybody.